Good afternoon, Downstate. Delighted to welcome you to the virtual Spring 2021 Town Hall meeting. I always look forward to giving you an update on all things related to Downstate and to also hear your questions. Thank you very much for joining us. As you know, we originally scheduled this in February, but that was the big weekend or week where we had the heavy snowstorm. So we didn't want to inconvenience all of you to continue on when the weather was deteriorating. Thanks for understanding that we moved it a little bit because of the weather last time. The program is simple. I'll give you an update with some slides, and then we'll have a update from Dr. David Berger, the CEO of University Hospital Brooklyn, and then we'll go right to your questions. So I'll cover a number of topics in this town hall, but again, we always like to get questions and ask for clarification on anything I talk about or Dr. Berger talks about. We'll be happy to. As we begin today, Downstate, I think it's appropriate that we pause just for a moment to remember all of those who have lost their lives due to COVID. And we will do so by marking a moment of silence, but I want to put it in context because we're still dealing with COVID to this day. And just this morning, I reviewed the statistics. We've had 543 deaths since the beginning of the pandemic in the United States, 543,000 deaths. Of that, about 49,000 deaths were in the state of New York. And of course, most of the deaths in the state of New York were here in New York City, which totaled 31,000 deaths. Overall, in the United States, we've had 29 million cases of COVID. Here in New York State, 1.8 million cases of COVID. And of course, New York City is a significant part of those cases, about 800,000 cases. So this is what we've been dealing with since last year, a little bit before this time. This terrible pandemic that's not only gripped the world, but gripped New York City, gripped Brooklyn, and the entire country. So let us pause for a moment of silence for all those who have lost their life to COVID, those that we know, some of our colleagues that have succumbed to COVID, and it's just appropriate again that we take a moment of silence. Thank you very much. I'll first give you an update on facilities. In spite of sort of the difficulty of not being fully operational as a campus, nonetheless, we've been very busy working on a number of projects that are very critically important to improving the quality of life for all of our members of our downstate communities. All right, we'll talk about a little update on campus facility projects and upgrade. The most, impactful and much anticipated project that we've been working on intensely for the last year is the plans and programming of the redo of the downstate cafeteria. And I thought that it's time for me to give you another update because we made significant progress. And I'll show you some of the renderings of how we envision how the new cafeteria will look and some of its amenities. And first of all, the food service will be greatly expanded and improved in terms of the way it's presented to all of us. There'll be kiosk and a mini mart approach with 24-hour access for some items to purchase. But as you can see, it'll be a much more modern, upgraded looking cafeteria setup. This is another area of how we envision changing the look and feel of the cafeteria with some renderings of how the space will be greatly enhanced with the addition of multiple areas for dining, for studying, for small meetings, and also for events. The picture you're seeing now is sort of an event space where you could have lectures, presentations, training sessions, etc. So again, creating more space for those of us to congregate once we're allowed to congregate, by the way. But again, making sure that we really provide sort of a new state-of-the-art cafeteria and amenity for the entire university campus. This has been something I've been very passionate about since I arrived. The then Chancellor Johnson mentioned to me that she thought we should really focus on improving the cafeteria experience for our downstate community. And we thank SUNY Central and the SUNY Construction Fund for all the work they've been doing with us to come up with the design and so forth. We've selected, the architect has been selected. We've had an interior design work with us. So this project is very far along, downstate community, and we hope all things going as well as possible to begin the process of the renovation of the cafeteria towards the end of this year, meaning November, December of 2021. And it'll take about 18 months for the whole cafeteria to be fully renovated. So this is a very exciting project. The projected cost is about $26 million. And SUNY Construction Fund is participating in the cost, as well as local funds here to the university. But I think this is going to be a tremendous amenity, much improved amenity for our community, to have a much better cafeteria and space for all of you to eat, study, meet, relax, etc. This is the way we'll expand the capacity of the cafeteria. So it'll be sort of added on. It'll go all the way out to that driveway that leads back to the guardhouse. The cafeteria will expand outward into the driveway between the Health Science Education Building and the hospital. Now, the other part, a project that we've been working on, is the improvement to the Lenox Road entrance to the campus, to the Health Science Center. So this is the rendering of how the new entrance to the Health Science Education Building will look. And you might say, well, what's different about it? Well, number one, you notice that those big clunky planters, they will no longer be there. Those were put in place post 9/11. We're going to move those planters. There'll be a new concrete entrance, much improved, with not as much slope, but we'll also have a revolver door there that'll be more energy efficient, because one of the biggest problems with the old entrance, in addition to its not being very attractive, is that it was terribly energy inefficient. During the summer, because the doors were open, it would let hot air in, and during the winter, cold air would get in. So it was always a problem keeping that entrance lobby appropriately heated and cooled all seasons. So now, with the energy efficiency of the revolving door and a much improved entrance, we think this is going to be a nicer way to enter the Health Science Education Building. In addition, once you go into the lobby, that whole area will be renovated as well. So again, you're going to see significant improvement in just how you enter the campus at our Lenox Road entrance at the new entrance to the Health Science Education Building, which is one of my pet projects that I felt strongly that we needed to improve the entrance on Lenox Road to match the nicer entrance we have on Clarkson, of course, with the Public Health Academic Building. This is the interior of the entrance. As you enter through the Lenox Road, this is we envision the flooring will be redone into a nice sort of terrazzo. They'll have some nice wood. Will it just improve the whole look and feel of when you enter the Lenox Road campus, which I think, again, will be much improved. The ceiling will be improved. It'll just be a nicer way to enter campus every day. And of course, we'll move the security station to the left of this picture so that it isn't on the right as it is now. The other project we've been working on is improvements to the Health Science Center of Brooklyn. That's its former name. It's the Medical Library of Brooklyn. The other part, too, is obviously for the students. We want to aggressively improve all of the amenity space for students, and the number one amenity space is the library. So we've, over the last 9 months, we've been working very intensively on a programming and concepts of how we can improve the library experience. We didn't wait for this, by the way, because we just placed some significant new furniture upgrades to the library on the second floor that, again, we wanted to match some of the things that were done in the Public Health Academic Building with the new style that was so popular with many of our students in the School of Public Health and other colleges and schools. So again, the library is a priority project because students, I understand, you need to have on-campus places to study as well as off-campus places to study.
And again, this is a commitment that I have to upgrade, and along working with the deans and the campus facility leadership to improve the library experience for you. This is a concept of the first floor of the library. As you can see, it looks very different from the way it is now. And as you can see, it'll be much more upgraded, better lighting, more aesthetically pleasing, new flooring, additional furniture upgrades, maybe with a little greenery as you see, but it'll be a much more inviting place for our students to study, relax, and to use the space in a more, I think, more popular manner. So again, the library project is coming along fine. We will probably update the campus towards the end of the year on when that project will get kicked off. The other parts too is some of the things that we're doing. You can't really see what we're doing because it's not very visible. And one of the things we're trying to do is upgrade all the behind-the-wall systems in the university. Some of our buildings are quite old and has older technology. And one of the key projects we're doing in terms of behind the walls is to improve the electrical capacity and internal electrical grid of the campus. And again, I want to salute Mr. James Minto and the FM&D group who've been working very hard on this. It's referred to as the electrical segregation platform or program. Which again, it's nothing exciting, but for the fact that we know we need better power to deal with power surges, to become more energy efficient, if you will, by improving some of the electrical back office operations. This is our existing equipment. Some of it dates back to the 50s and the 60s principally. This is not the way that most buildings are electrified these days. So we're going to, very methodically work through some of these electrical infrastructure issues, as you see, as are existing, to go to more updated, more energy efficient ways to provide electricity across campus. So this is, again, something you won't really notice, but over time it does improve the quality of our electrical work here at Downstate. Again, there's lots of other things going on in terms of new roofs being replaced. You may notice that we have scaffolding outside the Health Science Education building and, other things. The other thing that we obviously, everybody knows our official name was changed by the SUNY Board of Trustees I guess it was about 16 months ago. And we're also going to be changing the sign. The SUNY Downstate Medical Center sign will soon be the SUNY Downstate Health Sciences University, our new legal technical name as conferred by the state of New York. And so we'll be removing the medical center 2 words and replacing it with Health Sciences Education University very shortly. Some of you have asked me, hey, Dr. Riley, we still have the old name up there. And I said, I know, we're working on it. So it takes a little while to go through the process with the engineers and so forth. So this project is coming along. So again, my philosophy is, as much as we can, given the resources at our disposal, we will be upgrading as much of the physical character of the university and the hospital as soon as we can, when we have the funding, when we have the go-ahead from the SUNY Construction Fund. So again, I want to salute Mr. Minto and his team, John Sirachi, a member of his staff, for all the great planning and architectural work that goes into some of these things, because it looks easy downstate, but it really isn't. There's always a complication in terms of the procurement and the standards and all the things that we have to be cognizant of as we undertake all of these various facility projects. Next is the update to the website. I know this has been one of your pet peeves for a long time, that our website doesn't really reflect us, which I totally agree with. When I became president 4 years ago, it was clear to me that we needed to do something about the website. Unfortunately, it's taken a little longer than I thought to get the website redevelopment happening, but I can tell you we're now closer than we've ever been. And this is sort of a first cut at how we envision the website to look. It'll be a much cleaner look, less cluttered. You see hints of a new Downstate logo up at the top left of the picture. This project is, again, something I know many of you have wanted. The key issue, too, is it's not just the look and feel of a website, but what content is on the website. And so we've been intensely focused on the content because no website can be considered excellent unless its content is excellent. It doesn't matter how many pretty pictures you have, but it's really the content, the usability, the flexibility, the ability to get information about our campus, our community, and our programs, our schools, our colleges, our patient care, et cetera, in terms of making sure that the new website is our front door to the campus. Here's another sort of rendering of how we envision some of the content to look. These are sort of design sort of approaches, but as you can see, it just looks better. Here's the hospital-focused one, where folks who are looking for a doctor or looking for some information about University Hospital of Brooklyn, and this again, the education and training. So again, Downstate, please know that we're getting close on the website and we're making great progress. Okay, shifting to the state budget. As you know, this is state budget time. There are intense negotiations going on in Albany as I speak over the state budget. By New York state law, the budget has to be agreed to by the governor and both houses of the New York State Legislature by April 1st. So again, we're sort of in the last inning of the budget process for the state of New York, and I want to give you an update on its potential impact to the campus. Needless to say, because of COVID, the entire New York State economy has suffered. The New York City economy has suffered. The Brooklyn economy has suffered. And so at the beginning of, or towards the end of the summer, the Division of Budget for the state of New York put out guidance that was pretty draconian in terms of what the effect would be on all state agencies if there was no relief from the federal government. So again, the governor's first budget proposed $180 million in cuts to Medicaid to hospitals. Of course, that's one of the critical programs that we use to take care of patients. And again, the governor projected a $15 billion deficit that would result in deeper cuts. And as I just mentioned, the New York State budget is due by April 1st. The good news is there are some elements potentially in the budget of help. Many of you have asked about hazard pay. I lack the authority. The chancellor lacks the authority to provide hazard pay to all of our UHB employees who did such great work during the COVID era. And it can only be done through the New York State Assembly, the New York State Senate, and the governor, including it in a budget bill. The budget is potentially better now because of the relief bill signed by President Biden just about 3 weeks ago. It will provide about $12.9 billion to the state of New York, which will mitigate some of the worst impacts to the SUNY system and to New York State hospitals, et cetera. So that's very good news. So we're in a much better potential budget situation today than we were just a month ago. The American Rescue Plan passed by the United States Senate, as I mentioned, and signed by the President of the United States, included that New York State will receive about $23.8 billion in state and local fiscal aid. And it's broken down this way: $12.5 billion to the New York State government, $6.1 billion for New York City metro areas, $3.9 billion for New York counties, $825 million for New York small cities, towns, and $358 million for a new state broadband investment program. So again, this is significant infusion of funding to the state of New York through the American Rescue Plan that will help forestall some of the worst fears we had, not only at Downstate, but in the SUNY system and across New York State government, that absent that significant $12.5 billion infusion of relief funds, we would have had some significant issues in this upcoming fiscal year that may have led the governor and the legislature to entertain some very draconian things. So far, so good. We won't know exactly until April 1st, of course, as I just said, because that's when the governor by law has to, the both houses of the Assembly and the governor have to agree to a budget by April 1st per New York State law. All right, let's shift to the vaccinations. I talked about the terrible impact that COVID has had, but let's talk about how we've been doing in terms of vaccinations. As you know, the FDA has approved 3 vaccines for emergency use authorization. And like all hospitals, healthcare facilities, I wanted to give you an update on how well we've been doing with vaccinations. So as of today, we've given about 4,500 total individuals have been vaccinated in our downstate community. And I want to thank all of you for stepping forward of that 4,500 to get your shots. We met the 100% requirement as laid out by the governor and the New York State Department of Health for Tier 1 groups, meaning those groups who take care of patients who are forward-facing. We have only had to discard 1 dose in all the doses we've administered because of some snafu. We were able to get another 522 additional doses extracted by following FDA and CDC guidance in terms of getting more vaccine out of the vials supplied by the manufacturers. And our administration rate is over 100%, which was my goal. So I consider this downstate a success. As of 3/22, this is how well we have performed. Now, going forward, we still have some opportunity. Here it is broken down by sort of work site. University Hospital Brooklyn Downstate has about 2,700 employees. We've given about 1,500 first doses. So that's about closing in on 60% of UHB employees who've received the vaccine. But again, we want to do better. And we'll show you some of the groups within University Hospital that have opportunity to improve upon that. With the campus, the non-hospital part of the campus, we've given about 1,755 shots. 1,646 of them have been first shots. So that's about a 93% vaccination rate for the non-hospital part of the campus, employees of the campus. Now, we look at students. We've given about 2,000 shots to students, of which about 1,100 are first dose. So that's about 54% of our students have taken advantage of my decision to give our students earlier vaccine access than even other institutions in New York, because I deemed you guys so essential to the work that you have to do as students, and also how integral you are, obviously, to our university, that I made the call to put you in the 1A, 1B group so that you would have earlier access to the vaccines. And so, again, we have room for improvement, students. 54% is good, but I want to get it much higher. And you said, well, Dr. Wright, why should we get it higher? Well, remember, we all want to go back to a regular academic experience for you, meaning here on campus every day. The best way and the quickest way we can get you back to campus here every day in the summer and or the fall in particular is to get as many students vaccinated as possible, because this will be one of the metrics the SUNY system and the governor will use to give me the authority to bring you guys back full time. They're going to say, Riley, how many of your students have gotten vaccinated? Because they do not want to have outbreaks at any of the SUNY institutions. So students, if you've not gotten a shot, get it. Strongly consider getting it. It doesn't matter that you get it here per se, but that you let us know that you've gotten it. And Dr. Jeffrey Putman will be sending out periodic surveys to you all the way through the summer asking you, have you been vaccinated? Because we want to have a nice number. I would like to see us about 80 to 85% of our student body by the time we get to August, when we hope to reopen the university back to normal operation. We need to get that number up, students. And again, the totals are good as of March 23rd, but we have room for improvement. So I want to thank Dr. David Berger, Pat Winston, Daniel Graves, and the folks at UHB who took on the task of organizing our vaccine program. Very proud, very happy with the progress. Again, when we look at the data here, we have a little bit, here's some more data, the way we broke it down, because I see this report on a weekly or a couple times a month basis. Faculty, house staff, fellows, PAs, 52%. Nurses, 23%. techs, our radiology techs, CT, vascular, EKG, 3%. Room for improvement, colleagues. Remember, you techs are you're touching patients every day, performing EKGs and helping with procedures and getting X-rays and ultrasounds. So I really would encourage you, those of you who are techs, who take care of patients alongside nurses and doctors, to strongly consider getting the vaccine. The respiratory therapists, PT, 2%. So again, room for improvement. Social work, pastoral care, and dietary, room for improvement. So again, I'm happy with these results as of March, because we have about 1,528 UHB downstate employees vaccinated, but we have more to go. With 2,700 employees, we're about halfway there. I'd like to see us get, again, much higher numbers. All right, commencement. I know students are asking, hey, Dr. Riley, are we going to have a commencement? The answer is complicated. The simple answer is we are going to try, based on guidance we received from the Chancellor and SUNY Central, to have an in-person commencement. Unfortunately, it cannot be held at Carnegie Hall because of the capacity constraints. Carnegie Hall is a beautiful setting, but the governor has not allowed any activity in New York cultural venues such as Lincoln Center, Carnegie Hall, other large arenas such as Barclays, Madison Square Garden. All those are limited to 10 to 20% capacity. So obviously we can't effectively have a commencement at Carnegie Hall with those kind of requirements. So instead, we are going to try to organize, and our team is working on it every day, to have an outdoor graduation for you at a location within New York City limits. We can't say exactly where it is because we're negotiating and doing all the negotiations that we have to do to get the equipment and all the logistics of having an outdoor graduation. But I am firmly committed, class of 2021, to giving you a in-person graduation. Now, the unfortunate part about it, even though we will work to get you an in-person graduation, it's going to come with the requirement that you cannot invite your entire family. You will probably be limited to the number of guests that you have. We're still working on how those limits will look. But obviously, I know this is something that's a little bit disappointing to you. But again, I felt strongly that even with the capacity constraints that we have because of the public health emergency, that we still are committed to trying to give you an in-person graduation, with the caveat that you'll have limited number of guests to participate. So again, the class officers of the class of 2021 will be meeting with Dr. Putman to help us work through some of the logistics and the planning. The commencements will be different this year. They won't be as long. There probably won't be major commencement speakers or any of the other stuff we would normally do. So it'll be a sort of slimmed down in-person. You'll still get to march with your robes and gowns and all the pomp and ceremony, but it'll be in a much more time efficient, more socially distanced way that we intend to stand up Commencement 2021 for the class of 2021. So more to come from Dr. Putman and the Student Affairs Division and the team, but just rest assured, class of 2020, we are talking about commencement every day, and we have to take our guidance from the SUNY Central and the governor. So here again, these just recap what I said. We're currently planning in person. We have to, per the directive of the governor and the SUNY Chancellor, plan for a virtual ceremony as a backup plan. And the reason why we have to have a backup plan is if New York City has another surge like we had back last spring, then the governor would order no graduations. So we have to have that plan in our back pocket, if you will. And again, as I said, in person we'll have limited or no guests in attendance. We hope you can have a few guests. I don't want to just make it you if I can prevent it. But again, that depends upon the directives from the governor and the New York City Health Department and the New York State Health Department. And again, we'll plan a virtual if we have to. I do not want you guys to have a virtual. I'm committed to that. But just understand there's lots of constraints. We're going to have it the week of the May 20 4th. I'm sorry, that's a typo, not April 24th. It'll be the week of May 24th. We may have to have 3 or 4 different ceremonies in order to split up the class of 2021 in sort of groups of 100 or less in order to accommodate some level of guest. So again, this is the plan that Dr. Putman and our team are working on. Should we have 2 graduation days or 3 or 4 or have 2 on one day and 2 on the next? This is all, it's very complicated. So again, class officers 2021, please, have dialogue with Dr. Putman and he'll explain to you all the logistical hurdles we have to get over in order to get you a nice graduation, at least under the circumstances. Again, I'm fully committed to this. I will ask you to start thinking of your questions. But before that, obviously one of the other things I have to salute is the outstanding work of University Hospital Brooklyn during the whole last year and how they have risen to the occasion to take care of folks from Brooklyn and our neighborhood dealing with COVID. I'm very proud of all my colleagues, whether you are in environmental services at UHB, whether you are a ward clerk, a nurse, a respiratory therapist, social worker, dietary, thank you for what you have done over the last year. You have done great work. I'm very proud of you, and thank you again. And as part of that, during the pandemic, we were able to recruit back to Downstate an outstanding Downstate product in Dr. David Berger. Dr. Berger went to medical school here. He trained as a surgeon here. He then went off to Texas to train at MD Anderson to become a surgical oncologist. He was a very successful surgeon and surgical oncologist, and then he got the bug to become more of a hospital administrator, and he served in a number of hospitals in Houston, Texas. Dr. Berger and I knew each other when we both were in the faculty at Baylor, so I'm just tickled pink that we were able to recruit an outstanding CEO of University Hospital of Brooklyn in the form of Dr. Berger back to Downstate. I want to salute Miss Pat Winston. She did a terrific job as our interim CEO of the hospital, and she works side by side now with Dr. Berger as his number 2. So they form a great team, a great dyad, and they're doing some terrific work at University Hospital Brooklyn. So Dr. Berger, I'll turn it over to you before we take questions.
Who's currently the medical director of the STAR program. And I want to thank the search committee that was chaired by Dr. Ed Heilman and included Mafusa Rahman, Audrey Bendo, Laurie Donnell, and Pat Winston. We received almost 100 applications for this position, and they did a great job in whittling it down, and clearly Dr. Youssef was head and shoulders above the field. So we're very excited that Jamila is going to join us as CMO, and she will begin her new job on April the 5th. We want to thank Dr. Nakashbandi for stepping in during the COVID crisis as the interim CMO. He did a phenomenal job, and Rami will be stepping back in the CQO role. Can we mute the audience right now, please? The other person I'd like to welcome is my Chief Strategy Officer, Delphine Mendez de Leon. Delphine joins us from most recently Health IT Tech, but she's been a director at Huron, one of the biggest health consulting firms, and started her career in Brooklyn as an administrator at Brooklyn Hospital. And finally, I'd like to welcome Christina Gray, who's our new AVP for ambulatory care on the UHB side, and she is going to work with us to help advance our clinics and make them more patient-focused, as well as to help us grow our outpatient services. Moving on to our clinical services and clinical updates, as Dr. Riley mentioned, this is over a year since we've been dealing with COVID. If you look at the most recent surge, which really began in November, we've treated 436 patients to date with COVID-19 since November. And I'm happy to say that the mortality for admitted patients to UHB from COVID has dropped significantly to where it's only 13%. If you remember back in last spring, the hospital mortality across New York was over 30% for patients admitted to any hospital with COVID. So we've made great strides in being able to treat those patients. In addition to treating our inpatients with COVID, we stood up a program of infusion with monoclonal antibodies for COVID. That's patients in the community who test positive for COVID, who are high risk for progressing to severe disease, but have not yet progressed to severe disease. And I want to thank the whole team, including Dr. Nakashbandi, Dr. Rahman, Dr. Augenbahn, for getting that infusion program up and running. As Dr. Riley mentioned, we have vaccinated 4,600 people, and really need to acknowledge Tina Rhea, Dan Graves, and Cynthia Marguerite as three of the leads for getting that done. To move away from COVID, our transplant program is up and running again. We did our first renal transplants back in December, and we've done 5 transplants to date, all of them successful. Patients have done very well, and they are home and enjoying the fruits of renal transplantation. We have actually recruited a new chief of the Division of Transplantation, Caroline Rochon. She is coming to us from Hartford Hospital, where she has a very large renal transplant program. She does over 120 renal transplants per year. 40 to 50 of those are living-related transplants. And Dr. Rochon will probably be joining us in May part-time, and then full-time the first week in July. So we're extremely excited about the progress we've made in our transplant program. Last Wednesday, during Patient Safety Week, was our first Quality and Patient Safety Fair. We had over 300 people registered for that fair. The keynote speech was given by Dr. Mark Chasson, the CEO of the Joint Commission. We had 170 people logged in for the first phase, which was 4 talks given by members of the faculty, which were really outstanding. We had a very well-attended poster session. We will be awarding prizes from that poster session. So we're very excited about how that Quality and Safety Fair went, and we're already planning for next year's event. In terms of facilities, we are about to open a brand new mammography unit on the 2nd floor in radiology. I was able to tour the facility last week. It is simply spectacular. It is beautiful, state-of-the-art. The amenities look very, very nice. It is very welcoming for our patients, and we are really excited to be able to open that. We are looking to open in May after we get certifications and approval from the various city and state agencies. The other project that's well on its way is the fact we're building a new biplane interventional room, and we'll be putting brand new equipment into that room, and hopefully that will be completed in 2022. We are beginning to scope 2 projects, and they are moving forward very quickly. One is looking at the 3rd floor labor and delivery. We will be doing a complete refresh, replacing the entire floor in the corridor, as well as adding bathrooms, private bathrooms, to the rooms on our postpartum unit. We're very excited that Dr. Camille Clare is our new chair of OBGYN, and we are committed to building women's health as a marquee program, both at UHB on the inpatient side, as well as on the outpatient side. And the 4th facility project I just wanted to talk about that's moving forward in planning is to redo our ICUs. Anyone who's been to our ICUs know that we have open units, and that clearly is not optimal for patient care, either to receive patient care or to provide patient care in that setting. And we are working quickly to try to remediate that specific issue. Moving on to equipment, we have 2 new very important systems that are in the process of being brought up. The first is a brand new nurse call system throughout the hospital, and that is almost at completion. And the other thing that we are in the process of implementing, and I want to thank Dr. Rahman for taking the lead on this, is instituting hospital-wide telemetry. Everyone who practices in the hospital knows that our limited telemetry access is a major problem in terms of caring for our patients, as well as throughput through the whole institution. So those are the 2 most significant equipment acquisitions that are very close to implementation. And finally, I just want to talk about strategy and where we're headed. And the first thing, and one of the reasons why we have the Quality and Patient Safety Fair, is because we are beginning a journey towards high reliability. And what that means is we are aiming for zero harm. That should be our goal, and that will be our goal over the next few years. We have an RFP out on the street, and we are looking to partner with a highly reliable organization such as Joint Commission or Press Ganey or others who may be interested in working with us to begin this journey. And we are well on our way. I want to thank Dr. Ren Lester for helping that RFP. And the plan is to begin our partnership and our HRO journey in July of this year. Second, and one of the most important projects going on at Downstate is Project Phoenix. And I want to thank Dr. Riley for instituting this journey about 3 years ago and creating the vision for a state-of-the-art ambulatory care center. Where we are in the project is we are currently working with an outside consultant, Deloitte, to build the business plan and determine what are the marquee services that will be going in this ambulatory care center and how we will reconstruct our healthcare delivery model to adapt to the changes that have gone on as a result of COVID and will continue to progress and move from volume-based care to really value-based care. And Phoenix will allow us to accomplish that goal and help us on our highly reliable journey. At the same time, we're building out our plan for Phoenix. We are also engaged in a clinical strategic plan. And what we're really trying to figure out is how we're going to grow our clinical practice. We have become very reliant on our admissions through the emergency department, and we need to rebuild our referral practice. And as we have an opportunity with our new website to be able to market Downstate as a healthcare destination. So that clinical strategic plan is ongoing. And finally, we're working with our SUNY Construction Fund colleagues to develop a master facility plan for the campus. So what will this campus look like in 5 years, 10 years, and 20 years down the road? And that work will begin this year. So a lot going on. I want to recognize again my leadership team as well as my colleagues on the university side. And I really am honored to be the CEO of UHB and to work with a wonderful team. So thank you, Dr. Riley, for this opportunity.
Great. Thank you, Dr. Berger. Excellent work. I'm very pleased with the progress continuing the progress started by Ms. Winston during her tenure as interim head of the hospital. And of course, all the work that you and the team have done, the new recruits to your team. Again, our philosophy, and David and I are in accord, is that we want just as good a care for our patients in central Brooklyn as they can get across the water in Manhattan. And I know some of you saying, hey, Dr. Riley, how is Dr. Berger hiring all these people? Well, the simple answer, Downstate, is we have to have the people to run the hospital. Hospitals don't run by themselves. If we're going to have a transplant program, then you have to have transplant surgeons. If you're going to try to grow the business of the hospital, then you need a strategy officer. So all the hires that I have approved for Dr. Berger in the hospital have been done with that goal in mind, is to grow the business of the hospital so that the hospital doesn't lose as much money as it does today going forward. The hospital is losing money because we don't have enough patients. We need more volume, we need more activity, we need more surgeries. So the way you do it is to put the plans and programs and recruit people to work on growing the business of the hospital. Not only growing the business of the hospital, making sure the hospital has quality care. And again, I'm very, very pleased with the fact for the last at least 2 years, we've been able to do fairly well in the leapfrog external ratings of our quality. We've made progress in a lot of issues in terms of the quality that not only just our hospital has, but other hospitals in New York City and around the country have in terms of quality of care. We've made great progress. So I know some of you say, well, gosh, there's a whole bunch of new doctors at the hospital. Yeah, there are, and there's going to be more because we want to grow the business of the hospital. So let me turn to some of the questions. I think you had some good questions in the chat. So the first question goes back to the facilities. Someone was saying that the revolving doors are a fire hazard. No, they're not. There's no way the State Construction Fund would approve a fire hazard entrance to Lenox Road. In the picture that I showed you, there was the revolver, but there was a single door to the left, and that's per fire code. So rest assured, we do everything under my administration based on code and life and safety. So there's no concern with that being a fire hazard. There was some concern about the new revolving doors. Will they be as heavy as the ones at Fab? Probably not. Remember, the Fab, the technology in those revolving doors are probably now 12 years old. There's newer technology for these doors, and we'll make sure that in the engineering and the procurement that we make sure that we, quote unquote, road test the doors to make sure they're a little bit easier to work. Lots of comments on the physical space and some of the things we've been doing. Thank you. Somebody asked a great question. What is the official name of the hospital? The official name of the hospital is University Hospital of Brooklyn, in acronym UHB. That is the technical name for the hospital. The name of the university is SUNY Downstate Health Sciences University. Now, one of the things that Dr. Berger and his team will be studying over the next year is, do we need to change the name of the hospital? Most people, when you say, I work at UHB, they have no idea what UHB is, but you say, I work at Downstate, they say, aha, I know where that is. So again, this is part of our marketing review of the hospital. Should we retain the UHB name or change the name to Downstate Medical Center Hospital or Downstate Hospital Center or something? But I'm going to leave that to Dr. Berger and his team. David, do you have any comment on the name of the hospital?
We need to change it. I don't want to change it to Downstate University Hospital because then it'll just be duh. So we need to work with our marketing team and test some of the names that we were thinking of and some of the ones that you mentioned.
Correct.
And I would suspect that you and your team will probably survey the community about, quote unquote, the name. So yes, we are looking at changing the name of the hospital, but as of today, the technical name of the hospital is University Hospital of Brooklyn at Downstate Health Sciences University. Great question. Let's see, I'm scrolling down. I apologize, there were some technical difficulties early. Some people couldn't see the slides or couldn't hear the presentation. Hopefully that got fixed. There was an echo at some point. Again, sorry about that. The saliva testing. How is the saliva testing used and where is the data stored? And why do we need to do weekly testing? The saliva testing was a mandate by the SUNY Board of Trustees and the SUNY Chancellor that all SUNY campuses had to implement pooled saliva testing for surveillance of COVID. So we had to comply with the SUNY directive from the Chancellor, as did all the other 63 other SUNY campuses had to employ pooled saliva testing. And the good news is, because of that mandate, the other SUNY schools have had very few outbreaks of COVID on their campuses, on our SUNY campuses. But if you look at some of the other universities in New York, Syracuse had an outbreak. Some of the private colleges that weren't having as vigorous pooled saliva testing had outbreaks of COVID. So the pooled saliva testing is a mandate that we had to follow per the Chancellor and the Governor. And that will continue. We're in dialogue with the Chancellor about, well, now that we have, the more people we get vaccinated, can we get the pooled saliva testing relaxed? And that's the discussion that I'm having with SUNY Central about at what point, when we hit a certain percentage of the campus who has been vaccinated, can we back off the saliva testing? So as of today, we don't have a clear answer on that, but as something I have inquired about. Somebody says, why don't we get the results from the saliva test? I believe you have access to this. You can get the results. I don't see Dr. Demisi. Dr. Demisi is our campus safety officer who's in charge of the pooled saliva testing. He's also the dean of the School of Public Health. We can get that answer for you. I think that there is a way for you to get the results. He gets the results on a every day basis from the pooled samples taken the day before. But if individuals want to know obviously, if you're not contacted, you can pretty much assume that you're negative. But we'll have to figure out if there's a way for you to actually go online and figure out your test results. So we'll check into that. Let's see. There was a question I see here. UHB is 57% vaccinated. What do you attribute the low turnout to? Well, I think it took a little while. We had some issues with getting enough vaccine at a certain point. It wasn't what, Dr. Berger will tell you, there were at least 3 or 4 weeks where we had no vaccine at all because the state and the city didn't give us any. And so during those times, we couldn't vaccinate folks. So that's one reason. The second reason is we understand there are some employees who are hesitant to get the vaccine. They wanted to wait to see how things turned out. But I can tell you, I just looked at the data today, Downstate. There have been, 128 million doses of vaccine given since January. 128 million. And you know how many people have died after getting the vaccine? 0. Out of 128 doses, no one died from the vaccine. So some people were worried, well, will the vaccine give me, more likely to die? The answer is no. Out of 128 million shots, 0 deaths attributed to the vaccine. So some of the nurses have been reluctant. Again, Dr. Berger and his team and Ms. Winston are talking to the nurses. Nurses, if you're listening to me, you need to seriously consider getting this vaccine. It is very safe. Out of 128 million people, 0 people died. And remember, that is the real goal. The true goal of all the vaccines is, number one, keep you out of the hospital. There's 4 reasons. I would say 4 reasons why the vaccines work. Number one, keep you out of the hospital, keep you out of the ICU, keep you off a ventilator. And number 4, the most important reason to take the vaccine is keep you out of the funeral home. That is the key reason as a physician. I have no hesitancy telling you to get this vaccine. I myself have gotten Pfizer. My wife has gotten it. My mother, my disabled brother has gotten it. My sister, who's a nurse, has gotten it. As soon as it's allowed, my two daughters will get it, who are age 18 and 22. I have no hesitancy recommending to anybody that they get this vaccine because it does those 4 things. Keep you out of hospital, keep you out of the ICU, keep you off the ventilator, and keep you out of the funeral home. So nurses out there, please consider this vaccine. The other thing, many of our nurses work at other hospitals in New York City. They work extra duty at other hospitals. If you work at a private hospital anywhere in New York City for your moonlighting job, it is highly likely at some point that private hospital will require you to be vaccinated as a precondition for you working there, even part-time. It is also not unreasonable to expect that some of you who returned back to the Caribbean, there are some Caribbean countries who will require vaccination for COVID as a condition of entry into their country. The Caribbean nations do it now. There are certain shots you have to have in order to travel to the Caribbean and parts of the world. So this is not going to go away in terms of how inconvenient it will be for you at some point not to be vaccinated. So again, please talk to Dr. Berger, Ms. Winston. They will answer your questions about the vaccines. There are 3 FDA emergency use authorized vaccines that have been authorized by the FDA. There may be a 4th coming up, and there'll probably be at least 1 or 2 others before the end of 2021. So total, we'll have about 5 to 6 very safe, very effective vaccines for all Americans to take advantage of. So again, those of you who are hesitant, talk to us, ask the questions. But don't fall victim to some of the internet craziness out there about the vaccines. You just heard the facts. 128 million doses of vaccine, and not one person died in that 128 million because they got the vaccine. Now, they may have died of other things, but they did not die of the vaccine. Let's see, other questions. Are you still required to come to campus to take a COVID test if you are telecommuting? Let me ask Ms. Aronin. Heidi is chair of the Back to New Normal Task Force. Ms. Aronin is our excellent administrator who does all these complicated things for all of us. So Heidi, help us out.
If you are someone who is telecommuting completely and not coming in onto campus, you are not required to have the test, but you are required to respond and notify. And I think there's something in the email. You're required to respond and notify that you are working entirely remotely.
Great. Thank you for that, Ms. Aronin. Great question here. Someone asked, what about the offsite offices for the vaccine? Well, again, because we had such limited supply, and the rules by the Commissioner of Health and the governor were that no, you first have to do hospital-based employees and clinical folks first. That's why we couldn't push it into the offsites. But now, over the next month, we expect to be able to provide offsite vaccination for our employees, not only our SUNY employees, our UHB employees working in outlying clinics, but also our University of Physicians of Brooklyn clinics and their employees. So Dr. Berger, Ms. Winston, Ms. Rhea, Dr. Rhea, and Mr. Graves will be working on a plan to get the vaccines to those offsite places. Again, part of the issue is the supply has been a little bit, unpredictable. And again, I think the J&J vaccine is going to be very helpful for the outlying clinics because it's a very effective vaccine and it's one dose. So again, Dr. Berger and his team are working on the outlying clinics as soon and as fast as we can get the clearance from the governor and the Department of Health on how to do this. We will push it out. Other questions about the pool testing. Dean Demisi answered the question, no one will be able to see other person's pool or survival results. So there was some concern, hey, can my coworker see my result? The answer is no, because the way that the test is done and reported. To see your own results, he says, please go to your account and you will be able to see your results. So there, Dean Demisi just said, you can see your individual results by going to that site, but we'll get information out as follow-up to this, how you can do that. Let's see. I am wondering, receiving every week email to participate in pool testing. Am I not in risk exposed in a large crowd, even working telecommuting? Should we need to come only for test? Again, Ms. Aronin just answered that. And the issue is, because this is a mandate by the governor and the state, and also the unions, your union agreed to this, by the way, with the governor to implement whatever union you're in. The governor secured agreements from all of the unions that represent downstate employees to implement saliva pool testing.
Some people are coming in every other week, or they're not coming in as regularly, and we didn't have the capacity to target the emails that specifically. And so we send the emails out to everyone, and we ask people to notify if they are not on campus or not expected to be on campus.
Right. Thank you, Sarah.
Dr. Camille Clare, our terrific new chair of OB, asked a good question about commencement. Will there be faculty participation in commencement, and what will that look like? Dr. Clare, unfortunately, we will not be able to have, because of the capacity constraints dictated by the governor and the SUNY chancellor, the normal full academic procession of faculty that is such a time-honored tradition in academia. So I've asked the deans to figure out some mechanism where we could have sort of a delegation of faculty from each of the colleges and schools. Now that delegation may be limited to 25 faculty from each school or whatever. But again, we have to clearly get the guidance in terms of how many people will the governor and the Department of Health allow us to have at an outdoor graduation. So obviously the graduates are first, then trying to figure out how many guests they are allowed to bring, plus how many faculty can participate, if any. So again, this is the logistical challenge, unfortunately, about how we will have to stand up commencement this year. So, I can't wait till we get back to a regular commencement. I feel badly for the class of 2020. They didn't get an in-person graduation. They had to do it all virtual, and I really regret that. And we're still trying to think about how we can appropriately, have the class of 2020 come back at some point to have some semblance of a commencement that they unfortunately were deprived of because of COVID. I think we've asked a lot of questions about pooled saliva testing. There's other questions. What is the policy of the departments to staff members that were in contact? In contact with a person who tested positive after the saliva test. Heidi, you want to handle that one? How that's handled?
Actually, that's more of a Dean Demisi question.
Oh, as Dean Demisi, if you're online, will you answer that question?
And I'll read it off. What is the plan for the fall semester? Will students be back full-time in person? The short answer is we are planning. The chancellor has told all 64 SUNY presidents, including myself, that we should plan to have a full reopening of the campus in August. Now, that plan will have to be submitted to the chancellor and the governor, and they will have to approve it. And again, a key component of that plan, as I said earlier, students, it makes it a whole lot easier for me to get you back here full time if I can tell the chancellor and the governor that 85, 90% of our students or 100% of our students have been vaccinated. So again, part of the onus is on you students, get vaccinated, because that helps us to get the plan approved to bring you back full time in the fall. Let's see, there was a question about when are we going to receive hospital staffing? We have weekly announcements of management consultants, but we need actual people to do the work. That's a great question. Hospitals have lots of employees, as you know. But again, you can't hire employees if you don't have patients. And we have to grow the patient population of the hospital in order to hire more staff. So again, I go back to what Dr. Berger said. We have made some critical hires at the hospital in order to grow the number of patients who come here. And again, these are the conversations that Dean Brunicardi and I are having, Dr. Berger, with the department chairs. We need more patients. Running a hospital is simple, Downstate. You got to have patients. You just can't keep hiring without patients. And so we got to build programs to attract patients to our hospital. Dr. Berger, would you like to add anything to that?
Yeah, so the one thing I would add to that is that our volumes are off 25% year over year, but we haven't gotten rid of people. So we have the same number of people essentially to manage 25% less patients in the hospital. So it's not like there's a shortage of people right now. There may be shortages in selected areas that we're trying to beef up, but overall, we don't have less people despite having significantly less patients.
Great, thank you, Dr. Berger.
Dr. Calera asked a great question. Is there any consideration for new electronic medical records such as Epic? Dr. Calera, yes, we're looking at that. Dr. Berger, you want to talk about our EMR?
Yeah, so we are not in love with the current EMR, and regardless of what we do right now, either we have to upgrade our current EMR or go to a new EMR. And we are in the process, and Dr. Rahman, who's our CMIO, is looking to engage a group to help us to work through that journey to decide which is the best EMR for a downstate. We also have to realize that we have I think it's at least 5 different EMRs on the outpatient side, and we have to unify our inpatient EMR with our outpatient EMR. So we are in the process of evaluating what our options are, and we will be involving our clinicians. And we also need some help to help steer that journey as to what the best cost is, what our costs can be, how we can save money in getting it done. Certainly our preference is if we can go with Epic because of what's around us, and we are evaluating the ways we could potentially implement. So we have a full court press on trying to figure out how to manage our EMR right now.
Great.
Thank you, Dr. Berger. Other quick questions I can take quickly. I know we're sort of a little bit past time. When do we return to work full-time on campus? We can't do so until the governor allows us. Because, remember, we're still under the public health emergency. And the only person in New York who can lift the public health emergency is the governor. And again, it depends on the virus. It depends on how fast we can get New Yorkers vaccinated. So again, it strengthens my position to try to get us back into school full-time, back to campus full-time. If I can tell the chancellor that, 90-85% of downstate is vaccinated. So it's critically important. Part of this is in our hands in terms of our ability to return back. I agree with you. I'm kind of done with Zoom life. I want to be back in a room with my great team and my administrators because I miss seeing people on a regular basis. But Zoom is the way we have to work these days, and I understand. And students, I understand. I feel frustrated that we've had to go a whole year with teaching you by Zoom, but thank you for hanging in there. But again, as soon as we can get people vaccinated, soon as we can get back to the regular order of being as an employee, a staff member on campus, and our students in. Somebody asked, do you people even go to the offsite offices to see what problems they are having? The short answer is yes. We go to the external places. And a lot of problems we address. Some we're working on. Some are more difficult to work on. For example, there's one clinic that I think we need to move. Well, we got to find another place to move it. You just can't move a clinic overnight or over 6 months. It takes a little time to move clinics. You have to get permission in some cases from the state of New York to move a clinic. So there's lots of things that we're looking at. But yes, Dr. Berger and I do pay attention to the outlying clinics. Last question, can we see the website slides again? We'll have these posted. And again, I think we answered a lot of questions about the, Dr. Claire asked another question, the J&J vaccine. We've already started administering the J&J vaccine to our inpatients and our clinic patients, right, Dr. Berger?
So we've been using it for our outpatients, our patients being discharged from the hospital right now. We only have a small supply, and we're trying to reserve it for them right now. If we get more, then we'll be able to widen the use of the J&J, and we're asking only for J&J right now.
Somebody else, Dr. Shirley Gerard asked a great question. I haven't mentioned anything about our community, i.e. Brooklyn. What will our goals be in serving our community as we move forward? Well, again, Shirley, we got to stabilize the hospital. That's why we got to, stabilize some of the issues there. And I think we've made progress, more to come. We work with any community partner that has approached us. I'm speaking all over New York City, all over Brooklyn on a like daily basis, trying to get particularly African-American communities to take the vaccine. The governor appointed me to the New York State Vaccine Equity Task Force. I'm also on the New York City Vaccine Equity Task Force, so I serve on both of those bodies, trying to get as many Brooklynites vaccinated. And again, my view is look, we have to every day improve how we take care of patients, how we educate our students, how we do the work of running this great university. So we're making progress, but still lots to do.
Can I make one comment to add to that, Wayne? So in terms of evaluating what we're going to put in the ACC, and how we're going to grow our clinical programs, there's a huge component of what the needs are in our community. So specifically, 2 programs that we're seriously considering, and I want to give a stat that 44% of the households in our primary service area are run by a single woman. So one of the programs we are looking to put into our ambulatory care center is a women's health initiative. The other major health issue in our community is obesity. So we are looking to put in a metabolic disease center in our ambulatory care facility. So we are trying to match what goes in our clinical programs are very closely to what our community needs are.
Great. Someone asked, we may have not answered the question directly about exposure to a positive person. Well, if you're exposed to a positive person, you'll be called by our contact tracers. We have, I think, about 125 fully trained contact tracers. So once we get that information known that you may have been exposed on campus to someone, you will be contacted by a contact tracer and put through the protocol as determined by the New York City Department of Health and or the New York State Department of Health. So yes, we have a battalion of trained contact tracers who will touch base with you. And if you self-report that, hey, I just found out most of the exposure, by the way, is not on campus, is out in the community. So if you get exposed to someone in your family or someone that you are social with, it would be real helpful if you report back to us, hey, look, someone in my Bible study, that I was at Wednesday night turned up positive. Let us know. We can help with the contact tracing. So again, part of it is an honor system. You have to tell us, particularly if it's off-campus exposure. Let's see. Something about not concerns of the employees affected with the virus and the cleaning of buildings. Our buildings are cleaned as best we can. Look, these buildings are old. Some of these buildings are old as I am. And so old buildings can be difficult to maintain. But we have, is Mr. Minto still on and talks about the cleaning protocols? We've improved the ventilation. We put in the HEPA filters. The MERV filters that are the high efficiency filters that filter out COVID if it gets into the air. Mr. Minto?
Yes, and in addition, we are continuing to clean the high touch point areas, extensively clean in the bathrooms, and we have the electrostatic foggers. Once we're notified that there's been through the contact tracers that it's a particular cubicle, depending on how when the last time it was occupied, we have the capabilities to do the disinfection there as well.
Right, great.
2 more questions, and then I know I got to let you guys get on the rest of your day. COVID-19 has shown that it is not imperative that employees come into campus. Studies have also shown that employees work harder when working remotely. Shouldn't we consider that option? Well, the short answer is yes and no. I don't have the authority to say that every employee can work remotely. There's only one person in the state of New York who has that authority, and that's the governor. So unless the governor negotiates that with the unions, I can't mandate that. So again, as state employees, we fall under the jurisdiction of the governor of New York. And many of you who are members of unions are represented by your union to bargain on issues of the ability of campuses to work remotely. But again, that's a discussion that will be taking place, I'm sure, not only in New York City, but all over the country, because we now know, yes, some work can be done remotely, or some work can be done on a platoon system where employees come in Monday, Wednesday, Friday, others come in Tuesday, Thursday, Saturday. So these are the types of discussions that will be taking place at the level of the governor, at the level of the governor's office of employee relations, at the level of your union leadership, whatever union you're in, I encourage you to bring that up to your union stewards and representatives to encourage them to have that discussion with the governor and the New York State leadership, because that is not determined by me. It is determined by the governor vis-a-vis your collective bargaining agreements. But philosophically, I understand your question. You're right. There are, now on the work side, now on the education side, it is clear that students do not like remote instruction. And they want to be back in class. They want to be back on campus. And again, this is the chancellor has gotten letters from students demanding tuition refunds because they're not going to class. So the students have voted pretty strenuously. They want to be back in person. And again, we want to bring you back to campus, but it will depend on our vaccination rate. It will depend on the state of the virus at that time. It will depend on all the requirements that we've had to live with for the last year as an institution and as a SUNY campus. So it's a yes and no answer, quite frankly. Yes, remote work can work under the right conditions, but no, education is best done in part in person. You can't phone in or Zoom in being a nurse. You can't Zoom in becoming a doctor for 4 years. We've gotten away with it for maybe 2 years, but to learn to be a doctor and a nurse and a physical therapist and occupational therapist, you have to be in a hospital or a clinic or come in contact with patients. That part of the health professions will never change, whether it's a pandemic, this pandemic, or the next pandemic. That we have to get creative about delivering clinical education in a health sciences university like ours. Okay, well, I'm going to cut it short. I think we've had a wonderful exchange of questions. And let me end where I always end, Downstate. Thank you for what you do. If you're a student, thank you for hanging in there for the last year, studying remotely or hybrid. Thank you for understanding we didn't force this on you. None of us wanted what has happened over the last year to interrupt or to affect your educational journey here at Downstate. But it's our job as educators to try to do the best we can to give you a high-quality educational experience in spite of the problems. And I think all our deans and faculty have worked very hard to give you some semblance of a normalcy in spite of the fact that you've had to, in many cases, learn remotely. Thank you to all of our employees who've been working. Thank you particularly to our UHB employees for what you have done. Again, I have been fully supportive of hazard pay, and if the governor includes it in his budget, we will be delighted to give you hazard pay based on the legislation that hopefully he and the members of the Senate and the Assembly will have. So I want to give you hazard pay, and I hope the governor and the legislature come to an agreement because you deserve it. So again, thank you to everybody who does their work on a daily basis at Downstate. I am honored to lead this great institution. My 4-year anniversary as president is coming up in a couple weeks. And I still love coming to work every day. Well, I don't come to work every day. I come to work 3 days a week because they don't want me here all week. But I work every day for you, even weekends. Even remotely from my home here in Brooklyn. I am working 7 days a week for Downstate, and it's an honor of a lifetime for me to work for this great university in a great city, in a great borough, in a great state university system. So thank you very much. Passover greetings to all of you who will be observing Passover, and happy Easter to those of us who also celebrate the Easter season. Please be safe. Do not engage in risky behavior. And we want to get everybody vaccinated, keep everybody healthy. So thank you so much. Have a good evening.